The act of falling is a common occurrence among the elderly. Statistically, more than one-third of adults ages 65 years and older fall at least once a year. While the majority of these falls do not result in injury, there is still the potential for moderate to severe injuries and even death to occur. Injuries resulting from falls can significantly reduce a person's mobility and independence. The risk of falling increases as people age. The aging process introduces many physical and cognitive changes, which affect one's strength, gait, visual spatial perception, and balance. For seniors, falls can occur anywhere. It is the responsibility of all staff members to prevent falls. As a staff member, it is essential that you are knowledgeable of the common risk factors that contribute to falls among the elderly and your role in the prevention of falls. This course has been designed with those objectives in mind. If you require special accommodations to complete this module, please contact Relias Learning customer support by calling or emailing support@reliaslearning.com. To access the full text of this module, use the Notes tab located above the menu on the left-hand side of the module. After taking this course, you should be able to list the most common factors that contribute to falls among the elderly, recognize the importance of fall risk assessment, identify the risk factors that could increase the likelihood of falls among people, recall your role in implementing a successful fall prevention program, list the steps that should be followed if a person falls. Why are falls a common occurrence among the elderly? While there is no single factor that is responsible for all falls, the five most common reasons for falls among the elderly are: 1. Changes in gait and increased weakness. 2. A decline in eyesight, hearing, and perception. 3. Dizziness. 4. Environmental factors. And 5. Cognitive impairments. The aging process introduces numerous physical changes which may affect a person's strength, gait, and muscle tone. These changes can increase the risk for falls and other accidents. Gait is a term used to describe a person's manner of walking, running, or moving about. As seniors age, changes in gait are not uncommon. Approximately 20 to 50% of elderly persons are affected by gait disorders. A decline in sensory function, such as diminishing eyesight, hearing, and a sense of balance, is another factor that increases the risk of falling among the elderly. People who have difficulty hearing and those who cannot see well, with or without glasses, are all at risk of falling. Peripheral neuropathy is a sensory condition that causes tingling, numbness, or weakness in the legs and feet. It can cause falls because feeling in the feet is diminished. Limited physical activity and medical conditions such as heart problems, heart failure, stroke, and Parkinson's disease may also affect seniors' sense of balance, thereby increasing their risk of falling. Dizziness affects seniors' sense of balance. Dizziness can be caused by cardiac problems, a sudden decrease in blood pressure, medication side effects, and even anxiety. Environmental factors also commonly contribute to falls among the elderly. Examples of environmental factors include objects on the floor, slippery floors, poor lighting, or throw rugs. There are several situations where environmental factors increases seniors' risk of falling. Environmental factors can present a potential hazard when an elderly person is bending over too far or reaching too high. This individual may lose their balance and fall. Many seniors make frequent trips to the bathroom due to an increase in urinary urges or incontinence problems. Some seniors may fall when hurrying to the bathroom to prevent an accident. In some cases, seniors fail to make it to the bathroom in time. As a result, the floor becomes wet and slippery, which can easily cause a senior to fall. Cognitive impairment may include loss of memory, poor problem-solving abilities, and decreased ability to understand directions. Cognitive impairments and confusion are another cause of falls among seniors. People may have cognitive impairments or confusion as a result of a permanent medical condition, such as dementia, or a temporary medical condition, such as an electrolyte imbalance. Dementia can impair judgment and visual spatial perception. People with dementia may become disoriented and highly agitated and are more likely to wander and may fall when doing so. They may try to get out of their wheelchair or bed unassisted, resulting in a fall. The following are common reasons for falls. Use your mouse to select all of the images that apply. Bending over, dementia, fatigue, hypertension, clean environment, strength. Correct. Dementia, hypertension, and bending over are common reasons for falls among the elderly. Let's continue. Once you have identified who is at risk, you can implement a fall prevention program. The success of a fall prevention program depends on you, the staff members. It is important for you to know who is at risk for falls, as well as the factors that increase their risk of falling. What else can you do to help implement a successful fall prevention program? There are several measures you should follow to help prevent a person from falling. First, it is important to always orient a person to their current surroundings. Orientation includes showing people the location of their rooms, the bathroom, and the dining room. You should always show them any other areas or rooms that are involved in their care. People who are unfamiliar with their surroundings are more likely to fall. Keep their surroundings clean and organized to promote safety. Clean up spills promptly to avoid wetness on the floor. Remember, wetness on the floor is an environmental hazard that can easily cause a fall. Be certain that the rooms are neat and clean. If someone prefers a messy room, make sure this preference is documented in their care plan. If someone prefers to have their room cluttered, staff should keep areas around the bed, common areas, and the path to the bathroom free of unnecessary items. Cluttered environments, particularly the area surrounding the bed and the path to the bathroom, are especially hazardous and increase the risk of falling. Take your time and do not rush when providing assistance. For example, you should not rush someone if you are helping them sit up in bed. Rushing a person while trying to sit up might cause them to become dizzy and they could fall. Have you ever felt dizzy or lightheaded after standing quickly from a lying or sitting position? This condition is called orthostatic hypotension and results from a sudden decrease in blood pressure when we stand. Be certain to use any assistive or safety devices that are indicated in the care plan. You should inspect all safety and assistive devices to ensure that they are working properly. Assistive devices that people may use include wheelchairs, grab bars, and walkers. Safety devices that may be used include a self-releasing belt or a lap buddy that a person can remove, and bed or chair alarms. Alarms alert staff members when people are attempting to move around without assistance. A bed alarm, for example, would alert a staff member if someone were attempting to leave the bed unassisted. You should not use side rails or physical restraints to limit a person's mobility or to keep them from falling out of bed. Research indicates that people have a higher incidence of falls and injury when they are restrained. Alternative solutions to side rails include positioning and body pillows. You should also encourage to use a trapeze or grab bar when moving around in bed or getting in and out of bed. Be sure to closely monitor whoever has been identified as a fall risk. Be aware if someone's gait has become unsteady, or if you notice any other unusual behaviors, such as an increase in agitation or confusion. Immediately report these and any other changes you observe to the charge nurse or physician. Once someone has been identified as having a risk for falls, you should monitor that person, put them in a wheelchair for their own safety, raise the side rails on their bed, make sure they take all of their medicine in the morning. Correct. When someone has been identified as a fall risk, you should continue to monitor them closely. Let's continue. Now let's review the key points in this course. There are several factors that can cause people to fall. While no single factor is responsible for all falls, the 5 most common reasons for falls among the elderly are changes in gait and increased weakness, a decline in hearing, vision, and perception, dizziness, environmental factors, and cognitive impairments. Each staff member plays an important part in reducing a person's risk of falling. All members of staff should know the factors that increase someone's risk of falling and what measures can be taken to prevent falls. Regardless of the cause, all falls should always be assessed. The IDT will conduct a post-fall assessment to review each and every fall. The IDT should be able to answer 2 specific questions. What is the most likely reason that person fell? And how can we prevent the person from falling again? Factors that should be evaluated when a person falls include the location and time of the fall, the staffing ratios and location of staff members, previous implemented interventions, environmental factors, the person's behavior and medical condition, medications. Following a post-fall assessment, the IDT will implement different interventions to prevent future falls as necessary. It is important to remember, however, that despite best efforts, intentions, and interventions, some falls are unavoidable. Remember, keeping people safe is your first priority. Preventing falls is a team effort and requires the input and effort of all staff members. Fall prevention is everyone's concern. Now that you have finished reviewing the course content, you should be able to do the following. List the common factors that contribute to falls among the elderly. Recognize the importance of a fall risk assessment. Identify the risk factors that can increase the likelihood of falls. Recall your role in implementing a successful fall prevention program. List the steps that should be followed if someone falls.